So the title of this session is A Second Widening Access Journey, Life in Medicine with a Disability. So round of applause for Ellen.
Thank you. Thanks for having me back again. So this is a bit of a different talk to anything that I've done before, and it's still very much something that I'm learning about. So I'm going to be talking about my experiences mainly. It's going to be probably a less kind of facts-heavy session than it could have been, because it is still something that's all quite new to me. So bear with me. So I'm going to be talking a bit about my disability, the adaptations that I've had in the workplace so far, how I've found working as a doctor with a disability and the challenges that I've faced, a bit about kind of my opinions on how best to support others with long-term health conditions and disabilities in medicine, kind of my reflections on what's happened so far, and some useful resources, and then there'll be time for questions. So last year I was diagnosed with multiple sclerosis. So I woke up in March last year with kind of a funny burning numb patch on my leg, and I kind of thought, oh, must have felt funny or something, that's weird. And then it spread all down my leg and all up the side of my body, and I was like, oh, that's a bit odd. And most people, when I get to this point in the story, say, why didn't you go to A&E? And I was like, there's no way I would ever go to A&E unless a limb was falling off. So I waited for a bit, and it kind of kept on getting worse. So I went to my GP. And I went to my GP and I'd done some pondering and some Googling by this point, and I said, I think I've got MS. And I think he just thought that I was being an anxious woman about it. But he did take it somewhat seriously, and sent me for an MRI scan of my spine, which was normal. And I think that kind of falsely reassured a lot of people involved that it was probably nothing. It then happened again to a lesser degree after I'd had quite a strenuous experience at the Eras tour. Ended up with the new numb patch, so I went back to my GP and said, look, this happened again. I don't think it's normal to be having this multiple times. Can I see a neurologist? So they referred me to a neurologist. In the interim between being referred for my neurology appointment and waiting for that appointment, I had quite a difficult time in my personal life. So my dad became very unwell, and kind of the stress then precipitated my worst relapse that I've had to date, which was vertigo. And I don't just mean being a bit dizzy. I mean, I could not walk in a straight line without just falling over, basically. So it lasted for about 3 weeks. And I saw the neurologist kind of towards the end of that 3 weeks. And he also was not particularly excited by my symptoms. I think he kind of heard about the stress that I'd been through and took that as being the problem. But he did agree to do an MRI scan of my head and my spine. So kind of reflecting on the interactions that I had with medical professionals in that early period, it was really challenging. And that was me being a doctor, being a radiology registrar, and obviously knowing quite a lot of what I was talking about. I had the privilege of my education behind me, and I still wasn't listened to. So I recognised that I had that privilege, and having spoken to other people with MS, you know, I was diagnosed very quickly as compared to a lot of other people. So there is still a lot of systemic barriers in the way of being listened to, and getting the validation that you need talking about your health. So I had the MRI scan, and that showed that I'd probably had MS for a lot longer than I'd had symptoms, and they were able to diagnose me just based on the one scan. So a little bit about MS, because I've got a captive audience. There's maybe stuff that you know, there's maybe stuff that you don't know. So I think these figures are a little bit out of date. I think there's over 150,000 people living with MS in the UK now. It disproportionately affects women. So there are about 3 times as many women diagnosed with MS than men. And most commonly people are diagnosed when they're in their 20s and 30s. So I was 28 when I first had symptoms. Everyone's MS symptoms can be very different. So the reason that you get symptoms is because of the areas of demyelination that you get in your brain and spinal cord. So there can be a really wide variety of symptoms. MS is chronic, progressive, and currently incurable, though there are more advances coming, which I'll talk about later, and it's where the immune system attacks the myelin sheath of the nerve cells in the brain and the spinal cord. The etiology is not completely known. There are a lot of kind of proposed ideas about EBV, about vitamin D. I did have low vitamin D, but that was before I started radiology, just saying. But there's no like definite definite cause found just yet. It can follow several courses. So there's relapsing remitting MS, which is what I currently have. That nearly always transitions into secondary progressive MS, where there are symptoms relating to the areas of damage that you acquired previously during relapses, or primary progressive MS, where things kind of get worse from the point of diagnosis. I think a common misconception is that if you have relapsing remitting MS, that you don't have symptoms when you're not having a relapse. And that's not true. You will have symptoms often relating to the relapse that you have had, because there's an area of scarring effectively in that bit of your brain. So the symptoms that I have relating to my previous relapses, I have balance problems. My balance is terrible. I try and do a lot of yoga to improve that. But you definitely won't catch me skiing now as a result of that. Fatigue is a really hard one to explain to people, because it's not just being tired. It's some days I can't like get myself out of bed and walk around the house without it being a massive effort. And I think it's really hard to explain that when some days I'm well enough to do a 10-mile run, some days nothing at all. So it's a really difficult one to explain, and it's been hard to explain to work how that affects me. I still get kind of numbness and tingling in my hands and feet relating to some lesions that I have in my C-spine as well, but that's quite intermittent. And I do experience Uthoff's phenomenon, which is when symptoms get worse when it's hot. Yeah, so there are treatments available for MS. I currently take an infusion once a month called natalizumab or Tysabri. That's one of the kind of OG MS treatments. It's been around for quite a number of years. That was the only one that I'd heard of before being diagnosed with MS. But there are loads and loads and loads of treatments out there and coming out. This is all very kind of new developments in MS treatment. It's kind of turning into a similar landscape to, say, IBD or rheumatoid arthritis, where there are lots of disease-modifying treatments around to kind of keep symptoms at bay. However, they don't cure you or completely stop having relapses. It's all to try and reduce the relapses. The newer ones are kind of the B-cell inhibitors. So ocrelizumab is one that I've had previously, and those are the areas where they're kind of developing more. There are some clinical trials into remyelination, which is really exciting. So that could be things that help the myelin reaccumulate in the areas of damage. So fingers crossed that goes through. And there's also stem cell transplants available for MS, which is something that I had no idea about. So a course of chemotherapy and then having your stem cells reinfused into you afterwards. So there are lots of treatments out there. There's a lot of progress being made in MS, but it would be better if it happened quicker. So working less than full time is something that I decided to do before I was actually diagnosed with MS. So I was always planning on doing it from ST3, mainly for financial reasons, to be honest, because that's when you get a bit of a bump in the pay scale. So it would have been more manageable. But it's meant that I'm definitely going to continue being less than full time. I had thought it would be possibly a temporary thing to help me get through exams, but now, no, it's definitely going to be a permanent thing. I've actually had a really positive experience with occupational health, which I think most people find a bit shocking because I've only really heard negatives about occupational health. I had an appointment with an occupational health consultant when I was diagnosed, and he was very validating. I didn't really need to tell him much about what I'd experienced. He kind of knew a lot about MS treatments and kind of adaptations that I might need. So it's actually really useful. And he gave me kind of a report to share with all of my future tutors, which has been really, really useful because oftentimes I'm meeting someone for the first time, telling them all of this about myself, telling all the things that I might need, and it is quite a lot. So I now get kind of a warning shot of sending them something and being like, just so you know, this. So it has been really helpful. It comes with its own challenges though. As I mentioned, loss of training time is a big one. I do feel that sometimes my weeks are taken up with things like acute CT, which is obviously a part of the job, but it's a part of the job that is more service provision rather than training me in my subspecialty. Kind of advocating for yourself and saying, you know, I'm less than full time, I don't work on this day. No, I'm not going to present something on this day, or I'm not going to attend this MDT from home unless my non-working day is moved. It's really hard to kind of advocate because you don't want to be seen as work shy. It's really hard to hold those boundaries, especially when it's coming from supervisors, consultants that you respect and that you think probably mean well because they're wanting to educate you, but don't understand where you're coming from necessarily. But I am lucky to be in radiology because it's very adaptable. So they've been quite good at kind of altering the sessions in terms of, I'm often better in the morning. So I'll be like, right, can I do my ultrasound or fluoro, which is more physically active then, and then have reporting in the afternoon. Hopefully when I'm a consultant, I'll be able to do some days from home and things. So I think I am lucky in that respect for sure. I am hopeful that work will continue to accommodate me. Everyone's been very supportive. The training team have been fantastic in asking questions and sharing the information with people that have needed it. So yeah, it's been a difficult but generally positive experience, I'd say, having workplace adaptations. This is not the case for everyone. So the BMA did a survey in 2020 with doctors who have disabilities. I think it's due to be repeated later this year. So only about half of people, medical students and junior doctors that have a disability, felt they had the adjustments they needed. 3/4 of respondents said that they were worried about telling work about the disability because of being treated unfavourably as a result. So I recognise that I am quite lucky where I've been. I think having a mostly hidden disability does bring different challenges in that I'm constantly having to tell people. So if I feel that I'm not able to do something, I have to say I'm not able to do that. And that's hard for me on a personal level to say that because I've always been a, overachiever. So having to say, no, I can't do that is really hard. And like I said, apart from the time when I couldn't walk, you wouldn't know that I have MS to look at me. I think especially like most people know that I do quite a lot of running and stuff. To be one day able to do that and then other days not, I think it's quite difficult to put that across to people. Being immunosuppressed as well. I'm currently less immunosuppressed than I was, and I've not found it too bad, to be honest. I'll see what it's like when I'm working full-time in peds again. But it is something that I'm always aware of in terms of what patients I see and PPE and things. And again, speaking up and saying I probably shouldn't see that patient that has flu, etc., can be a bit challenging. There's a lot of admin associated with being chronically ill. Appointments, blood tests, letters that you get. Being less than full-time has helped with that, but then it's often meant that I spend my non-working day going to have an infusion, going to a clinic appointment, getting some blood tests, which is not a rest, is it? So I'm glad to have that time, but it does feel like a second job at times. And then kind of coping with my own guilt about it. So when I've had to call in sick, I'm currently off the on-call rota, just because I've had quite a lot of relapses in the last 6 months or so. So occupational health wanted me to be a bit more steady before putting back on the on-call rota. So that's meant more work with some of my colleagues, which, I'm having spoken to people, they understand and don't mind. But yeah, I'm always going to feel a little bit guilty about that. But I do recognise that I need to be accommodated for. So how do I think you should support colleagues that have a chronic illness or disability? So ask about how they're doing and be prepared if they say not great actually, and ask genuine follow-on questions about that. Ask how the disability affects them. Don't make assumptions about the things that they can and can't do. So ask if they want help before offering it, because they might not want the help or they might really appreciate it. And I think if you're offering help to someone, try and offer something specific. So if you kind of note that someone struggles with a particular clinical task maybe, or gets more fatigued later in the day, say, would you like to swap this session? I'd be happy to do this. Coming to someone with a specific recommendation or suggestion, I found is better to kind of have it taken off your hands, because it's an extra mental load to say, actually, what do I really struggle with? How can you help me? So I've found that that's really helped. Be patient, be flexible, understand that people that are disabled or unwell don't want to be. And, I would very much like to be working full time again and doing on calls and things like that and not be in this situation. So believe them, understand what they're saying, and also respect how they use language about their illness or disability. So obviously when I first started describing myself as disabled, it was quite difficult because it was out of nowhere. 18 months ago, I had no health problems at all. But, having been on the process of kind of self-acceptance, I don't have a problem saying it now. That might not be the case for absolutely everyone involved. So kind of note what language they use to describe their illness or disability, and then use that in conversations. So having been on, a couple of widening participation journeys now, I've kind of done a lot of the getting in. So for me, it's now about staying in and feeling accepted. And I've been lucky so far that I have felt like I've still belonged where I am. I think there's going to be further challenges going forward when it comes to getting consultant jobs. Not that I think I won't be offered one, but it's just about finding the right place that's going to support me in the right way. Disability can affect anyone at any time. Like I said, 18 months ago, I was not disabled at all. So I think if you take it kind of on that more selfish level, the issues of the disabled people can become everyone's issue at any time. So they should be everyone's issue all the time. It's a new aspect of my identity. It's not the be all and end all, obviously. It is just a new part of it, but it's brought some positives as well. The MS community is really supportive, and I've met lots of really interesting, supportive people through it. I think it's made me more of an open person in terms of being able to have these conversations. And I think people kind of come to me with more issues now at work to kind of chat about things, which I, really appreciate. And that's come from me being open about the things that I've been through, kind of in the same way that me being open about being from a widening participation background previously has. A few resources now. I read this book by Grace Spence-Green recently. She is a doctor who had a spinal cord injury as a medical student, and she wrote this book about her experiences kind of straight after her injury, rehab, and then more about ableism and radical self-acceptance. These are all things that I'm very much new to and learning about. So if I give this talk in a year, I'm sure it'll be very different. But it's a really good place to start learning about kind of ableism and barriers to people that are in wheelchairs and using mobility aids and things. I found that a really, really interesting read. These are the three main MS charities in the UK. So MS Together is a charity aimed at younger people with MS. So those aged from 18 to 35, and they offer kind of more support services, like meetups and events for people with MS, which is really good. And their founder is a girl called Hayley Thompson, who was diagnosed with MS when she was 21. She has an Instagram account that's quite big called But You Don't Look Ill, which is talking about the difficulties of people with hidden illnesses. So I'd really recommend having a look at that. The MS Society does everything to do with MS basically, but is quite heavily involved in the research and funding research for new MS treatments. And the MS Trust is probably more of the kind of support service side, and they fund the MS specialist nurses, and every person with MS has access to an MS specialist nurse who are obviously an absolute fountain of knowledge about MS. So all really worthwhile charities. I am doing some fundraising, obviously, for the MS Society. If anyone would like to ask me about that, please do. I'm running 6 half marathons. Might not be running them all, might be walking some of them, but I'm going to try my best to raise a bit of money from the MS Society. Yeah, I've not shared my Just Giving on there because it felt a bit weird to do that, but if anyone would like to ask me, then fine, please do. That's just my LinkedIn again, and I'm happy to take any questions.
Did you have any questions? We've not, because I do have a question. How has this diagnosis changed your experience as a doctor? Has it changed your patient care? Obviously in radiology it's slightly different, but how has it changed how you are at work?
Yeah, I think obviously it's a little bit different in radiology in that we have less patient contact, but it's made me a lot more aware, particularly of how other people use language around disabled people, and kind of the preconceived notions that they have about what people can and can't do. And like quality of life and things like that. I think a lot of people have those preconceived notions of people that use mobility aids, who use wheelchairs, about what they're able to do and about what their quality of life is like. And I've noticed that in people's language quite a lot. So I do think it's made me more compassionate, but also, you know, it shouldn't take that, but I think it does. And me talking about my experiences, I think, has impacted quite a lot of my colleagues and how they perhaps talk about things like being less than full time for health reasons, and their kind of opinions on disability. So yeah, it's definitely impacted in a few ways, and I think talking is always going to be a good thing.
People at work, are you very open with your diagnosis at work? Do you talk about it? Do people know? Do they come to you? Like, I feel like it would just be such an asset to be able to have the experience as a patient. And
Yeah.
so do you find that you do that a lot?
Yeah, for a long time I didn't really know who knew and didn't know. So obviously told like my closer friends at work and the training team and a lot of the consultants that are involved in training did know. But then I think you always think people talk about stuff about you more than they actually do, and a lot of people had no idea. So I did eventually post on social media about it, and then I had a few more conversations with people who said they had no idea at all. Since being a bit more open about it, yeah, I think people do speak to me more about their own health and my experiences a lot more. And I think being open has only been a good thing, though it obviously comes with the kind of self-doubt, guilt stuff that plays into it of, are they going to think I'm less good as a radiologist because of this? I don't think that's the case at all, but obviously it's one of those things that's quite hard to come to terms with at times.
Thank you very much, Ellen.
Thank you.